Welcome to the village. So now I was able to steal some time from Dr. Hardies, as everybody knows and loves, has been at St. Mary's for how long now?
20 years.
Okay, and what's your background, and tell me a little bit more about you.
Well, I'm a board-certified internist. Practice now, this year will be my 50th year practicing, and I've practiced the entire time in clinical medicine, but also doing some occupational medicine as well. But my love is clinical medicine. So I've returned to Amsterdam, where I grew up.
You grew up here?
I did. This is my home. So I originally thought, after I sold a business I owned in occupational medicine, that I would come home and retire and take care of my parents who were ill at the time. So I did come home, and obviously I didn't retire. I think I was retired for about 2 weeks. Maybe 3, and then I got back into clinical medicine. Clearly the need is here for providers.
Yes.
Of all sorts.
Yes.
And it's been a joy.
Absolutely, you can tell, especially if you had an opportunity to retire and you'd rather be here.
I think that this opportunity at St. Mary's has been wonderful for me. For me, it's giving back to the community. That's what it is. It's giving back to the community. I think that the community's been good to me.
Yeah.
My patients have been good to me.
Yeah.
My patients are wonderful. I think that there is a relationship that we have struck over the last 20 years that is really a significant bond. And it's difficult for me to anticipate, and I think it's probably difficult for them to anticipate that I am going to retire one of these days.
One day.
One day.
One day eventually.
Yes, not today.
Good. I wouldn't want to catch you on your last day.
No, not today. I've always done clinical medicine, clinical internal medicine.
I think that bond that's created with the families, I'm going on my 9th year at St. Mary's, and just to see people I've seen as a newborn to now talking and walking, I can kind of get that sense. You do get connected with the families and strike a bond that way. So I understand somewhat of what you mean, having been here as long as you, but definitely I'm sure that's something very special. Tell me some of these changes you didn't expect in the latter years of your career, that a pandemic and so much change in EMR. You've seen a lot of changes. I just commented on your doctor bag I saw in here, and you told me it was from 1973. So from 1973 to 2023, that's 50 years. Just tell me some of the things that are important to you that you'd want our community to know, because they're going to hear this episode, and we just want to give them a message about St. Mary's, our outpatient setting, our care for them, and you as a doctor, would be really nice to hear from you what you have to say.
Well, how much time do you have? Because, this is medicine, healthcare in general has changed not just in an evolutionary fashion, but in a revolutionary fashion. It has changed dramatically, and most of it for the good, most of it for the better. We didn't have a lot of the diagnostic capabilities when I began practicing that we do today. St. Mary's has been able to put together a lot of those diagnostic capabilities, those technical issues, but more importantly, much more importantly, and I tell people this all the time, St. Mary's is not brick and mortar. It's not a primary care center. It's the people who work within it.
Yeah.
It's the people who make the organization work. And there are wonderful people who work here. As a physician, we have external customers, which are patients, and we have internal customers who are our staff.
Yeah.
The people who work with us and who make it possible for us to do what we do. I wouldn't be able to do what I do every day and see the number of patients I see and provide the service I do without skilled people working alongside me. They make me better.
Yeah.
They do. They do. They make me better.
As good as a doctor as the people who work with you. Right?
Absolutely. And they can make it or break it. And they do an excellent job, and I think they're committed. I think that this hospital, St. Mary's Hospital, is it is the number one most important institution in Montgomery County. In Montgomery-Fulton County, by far. And without this resource, and it's an excellent resource. Yes, it's a community hospital. It's an excellent resource. We wouldn't have the community we have. And we have lots of challenges in this community, including healthcare. including access to healthcare, including, quality of healthcare. We need to do three things. Our three things are, as we look at this being a patient-centric business, it's a patient-centric business. All this other stuff around it is supportive. It's patient-centric. We need to provide quality first, high quality, and it needs to be measurable. Number two, we need to do it cost effectively because it is a business. Hospital is a business. It has to pay its electric bill.
Yep.
And we have to provide access. People have to have access to those services,
Yes.
which can become difficult at times. I think that St. Mary's has done a good job in trying to provide an outreach to lots of folks in this area to either get in here for services that they need from a preventative standpoint or to minister to those folks who can't get in, particularly the elderly, the homebound. And I think that I'm thankful to be able to be a small cog in that machine.
Yeah.
It's a great institution. And I've worked in lots of hospitals over the last 50 years in a number of states. I actually at one time had 37 different state medical licenses because I owned 160 medical centers across the country in South America and in the Middle East. And I provided services for major corporations and their employees and retirees. That was a previous life that I left to come back and
done a
work
lot.
here. Yeah. And so I've seen what healthcare is like and how it's delivered in a large part of the world. And we're very fortunate to be here in the United States as far as the healthcare that's provided and available to us. Is it perfect? No. Would it be nice to be able to spend a little more time with patients? Yes.
Yeah.
But I think every year we further define and refine what we're doing as far as how we deliver that care. And I think at the end of the day, we're doing a better job.
Definitely would love to spend more time, like you said. We do enjoy our interactions, but I think most of the time duty calls. There's so many people that do need the care and attention. So you're right about St. Mary's. I think that sense of family and camaraderie and community is very unique here.
I think it is. I tell people that I first went to work for St. Mary's in 1964. I went to work in 1964 as an orderly while I was in high school. Okay. And it was great. Nights and weekends, I thought it was wonderful. I had a good time.
Yeah, teenagers, lots of fun to be had.
Yes, and there was a nursing school here.
Yes,
so there was always wonderful young nurses around.
Yeah.
Then I went away to college and medical school, and I came back and I worked in the emergency room during my residency, moonlighting. And I got to do lots of things that I otherwise couldn't do in my residency program. And I enjoyed it a great deal. And I remember, this is important for physicians, I remember one of the older physicians in the community saying to me one day, Doctor, what you need to do is listen to your patients. If you do nothing else but listen to your patients, they'll tell you what's wrong with them. And then it's your job to take care of that. It's a simple thing, but it's true. So I did that for a couple of years during my residency here. Then I went off and did a bunch of other things, interesting, eclectic things, and came back here when I was going to retire and found out 20 years later that retirement was not going to happen.
Yeah.
Yeah.
It's
and
hard.
I get to work with a lot of young physicians who are very bright and very capable.
Well, it's good to be inspired. I think we have to remember foundations and learn, and you just keep learning.
Absolutely, every day.
Yeah, absolutely. We can all learn from each other. And it's good to be inspired. Medicine is very different from what it used to be, even like I was telling you 10 years ago. So it's good to keep in mind what it was and where we're going. We can only have a good future if we remember our past, right?
Right. It's critically important that we learn every day. And that we recognize that while we may know a lot, we don't know everything.
Yeah.
And so we need to rely upon our colleagues to help us as well at times. And not just other physicians, but healthcare extenders who are very bright and very capable, as well as our staff. I think we learn a great deal from the nurses. The nurses have a lot of practical experience. They
do. They have a certain factor about them that we can't replicate.
We can't.
That's why we're a team. And, we also learn from our patients and our
Clearly
families.
we do.
Yeah.
It's an interpersonal dynamic, and it's critical. And I think we need to be open and receptive to listening to what they say, and recognizing that we can learn a lot from them, our staff and our patients. I have patients who come in who have researched whatever it is that's bothering them, a lot. And they'll test you on that, as they should, by the way, as they should. Occasionally, we're fortunate enough to get nursing or nurse practitioner students or medical students come by. I think that's great. That's wonderful because they're so smart. They're so bright.
It's good to have students. They keep you on your toes, too.
Yeah.
We do a lot of teaching in our job. A lot of teaching, educating everybody and learning and teaching. So it's a good place to be.
It is a good place to be. And I hope that I'm fortunate enough to be able to continue to do it for a while.
Yeah. Yes. I think a lot of people depend on that.
Yeah.
Is there anything else you want to add?
I think we need to continue to recognize that St. Mary's, or any institution for that matter, St. Mary's is a business, but what we do is personal. It's personal service. It's the most personal service you or I or anyone else access, to be honest with you. And we need to understand that. And we need to be humbled by the fact that we are given the opportunity. And I believe this. We're given the opportunity to be entrusted with the health care, such a personal issue for people. That's amazing when you think about it, to be entrusted with that. And you need to be honest and direct and committed, to providing that service to the best of your ability. Yeah. And I think we do that. I think we all do that.
I think so, yeah.
And I think we do it well. I do. I think we do it well. The day is clearly not a 9-to-5 day, not even close.
Yeah.
It is a 7-day-a-week job of varying hours. And, if I could do it over again, I wouldn't do anything different.
I agree.
Yeah.
I wouldn't do anything different either.
Yeah.
So,
we're fortunate. We're so fortunate to be in this position. Yeah.
We are. It's a blessing, and I hope, every time we get up in the morning, we hope we can go out and do the best we can do for as many people who need us and do it well. So.
Well, you're right. And it's important to want to get up in the morning.
Yeah.
to get up in the morning, because every day is a bit of an adventure. You don't know exactly what you're going to see, which is great. And I hope that never ends.
I agree. But thank you.
My pleasure.
And thank you for your time. I know that you're a busy man, but you're taking some time out to speak to me and address the community. So we all appreciate it.
Happy to do it.
Okay, so now I have Dr. Carlson here. He's going to give us his input a little bit. So, Dr. Carlson, first of all, how are you?
Always a bit overworked to a certain extent. But I'm doing fine. Thanks for asking.
Yeah, you're welcome.
Like I said, I have prepared nothing.
That's okay. That's hopefully I prepared enough for the both of us. It's good to check in and ask you how you're doing because, we don't do that enough as colleagues. We don't check in and make sure everybody's mental health is okay. So how long have you been at St. Mary's?
3 years, I think.
Okay.
2020.
Were you a fresh grad before that?
No. For about a little over a decade before that, I'd been at Ellis Hospital, which is down the road.
Okay. Tell me about, basically, you've worked through the pandemic at St. Mary's, and we've seen a lot of changes in healthcare. And, our community, being a rural community, has some of the brunt of these changes. So what have you seen with St. Mary's? What are we doing to help improve, our patient care and some of your goals and things you'd want to tell your patients in the community?
With respect to COVID specifically, or?
How they're kind of been negatively affected. I think morale is down, mental health issues are up.
I kind of thought St. Mary's did a pretty good job, at least when I came in, which was in 2020. Get access to testing. I mean, some of the problems with reagents and return tests and those sorts of things took a little while, but I don't think you could go anywhere in the capital region and do much better in terms of access to testing. When I showed up in 2020 or so, sort of coordinating those sorts of things, diagnostically speaking. Of course, back then there wasn't really immunizations or real treatments, certainly in the outpatient setting. Yeah, no, I came over from Ellis and I thought, quite comparable and if not a slightly different approach to it. And now, I think with the home testing kits and outpatient therapies, they're a lot easier than some of the infusions that we used to have to do. The immunizations and boosters and such. I don't know. I think we're doing okay. Of course, the long-term effects of COVID itself is going to be, I don't know, people will be writing books about it for a long, long, long
Yeah,
time.
I'm sure there's a lot of books already. And so do you feel like your patients have had to come back to coming back into the office and feel like they're getting good access? I think that's always a question, like not having enough access to come into the office or to get in touch with you or with us.
I could say I think the patient access as a component of public health is always going to be difficult, particularly in this neck of the woods. And, we're sort of facing a demographic, I don't want to call it a cliff, but a lot of our doctors are retiring, and the replacement primary care, both internal medicine, family medicine, and pediatrics, it's just, I don't know that it's going to meet the rate of the loss of the providers that know their patients very well and for the most part have their patients squared away. I don't know that our replacement rates are going to keep up with that perfectly well. So it's going to get a little tougher before it gets better, particularly with, I don't know that we've made the investments in terms of public health and educating primary care providers. They're going to make that transition. I think it's just, I don't know what the right adverb is or adjective is, but I think it's going to get a little tight in terms of access to doctors. Maybe that's a jaded view and maybe you feel differently. But like I said, a lot of our doctors are getting to the point where they're going to retire. And I think that's going to put even more of a crunch on access.
I think COVID probably pushed some more people into retirement, doctors and other healthcare providers alike, right?
Yeah. I don't know what the solution is, whether it's sort of focusing on nurse practitioners and PAs and recruitment or just an overhaul of sort of medical education approaches and, where we want to put our public dollars in terms of what would be best practices. For me, I would say I think we should start subsidizing medical school debt in order to get more primary care doctors.
Yeah, no, I think that's a work in progress, the medical school debt. Hopefully there's some resolutions to that. What about now we have, that's going to take a while even if we crunch out more doctors, but the providers that are here, like you said, we have mid-levels or recruiting more mid-levels and attempting to recruit more doctors. But in the meantime, all these people need care. And so what is the best way to get care? Is telemedicine a good alternative? I know we do have our video visits and things like that. What do you think about the telemedicine? Do you like to utilize it for the patients? Do you recommend it?
I mean, for some things, it makes a lot of sense. It certainly is a lot less burdensome in terms of documentation and the logistics, and is certainly easier for people. Obviously, you're not going to be able to lance a boil or something like that, or really do a good job for a rash or something along those lines. But certainly there are a lot of issues that can be dealt with either over the phone or by video, and that would sort of speed things up. I don't know any data that would suggest that helps with the overall access program, but perhaps, I don't know, maybe you do, or maybe you have an instinct to it that it really is quite helpful or not. I don't know. I'm not really prepared to make that conclusion as to whether telemedicine is an answer to the overall access program. I don't know. What do you think?
Yeah. I think it, like you said, it does help with some things. I think with mental health, sometimes it can be helpful. People sometimes feel more comfortable in their homes talking about their psychological issues, discussing those type of things, because we have seen more mental health come out of this pandemic and out of this world baseline. I think with the pandemic, we started telemedicine more, and it seems like it's here to stay. So it might be good for some things, just like a discussion, so to see if you actually have to come to the office or not. So if you just have some questions and you have some concerns, telemedicine might be good to weed out some unnecessary visits. So that seems like at least something to hold us and the families over. So just knowing that we have that it's good to have it there. I think it definitely helps some things.
To a certain extent, yeah. I would agree with that. It's not going to be terribly helpful for other access problems. If you're undoctored and you're in the emergency department, telemedicine is not going to be able to get you a sooner new patient visit, for example.
Yeah, I think that's another, I'm glad you brought that up. That was something else I wanted to quickly touch on with you. With the access problem, the urgent care and ER being utilized inappropriately, I guess. That's not a really good replacement. We are primary care doctors or providers. we're here for a specific reason, and the emergency room is there for emergencies. So just discouraging people from utilizing that as another option. I had a mother say that she was actually going to the urgent care for a second opinion. So that's really not the way to look at urgent care. If you want a second opinion, definitely go to another primary. Don't go to the urgent care. They're not really trained in primary care medicine. So anything you would like the community to know from your standpoint?
I think the providers that are here do a really good job. I've inherited, around the Capital District, as many patients as anyone else from residency days, and I've been at a couple different practices for Alice. They kind of shifted me around, so I think I might have inherited, for a 38-year-old, as many patients as anyone else my age, quite frankly. And coming here, kind of following on from providers that have retired or have moved on or whatever. I think the care that people have gotten is really quite good. I went up to Gloversville just this last year in lieu of a retiring provider there. And I usually tell people that are there that they did a really great job. All this stuff is squared away. Everything was really done and done correctly. And it really is just to get to know a new doctor, it really is to sort of get everything organized, squared away. And then it gets really, I wouldn't say easy, but it as long as things are accounted for and organized and you follow behind good doctors, things are generally not too problematic or troublesome. So I've been very fortunate in that respect. At least the doctors that I've followed behind. So hopefully we can just continue it on into the future. That would be my message of encouragement. I wish we had 10 more doctors, though.
Yeah, well, that's true. It's tough when you don't have enough people to see the patients, but I think we get as many people in as we possibly can. If someone needs to be seen, I feel like we just see them, right? If someone calls to be seen, how quickly do you get them in?
It would just depend on what the problem was or where it would most be appropriate to be seen. So, if it's, I'm calling with crushing chest pain, or I can't I can't speak correctly and I can't move my left arm. Obviously, we know where to send those people, which is not the primary care office. But if it's an acute primary care problem, generally the same day, or if it's something that can wait a day or two, depending on availability, something along those lines. And as far as I know, we're going to continually reviewing our acute visit access components and adjusting our templates to afford increased sick visits, as the case may be. So it's a work in progress. On the flip side, you don't want to be here necessarily till 8 at night. But to answer your question directly, same day or the next day.
Yeah, I feel that way. And I didn't see that across the board in other areas. Like my primary care used to be in Albany, and they were going to get me in a month later for a sore throat. So we definitely wouldn't do that to someone. Any other things you want to say?
Everyone read the Commonwealth report from the Commonwealth Fund on American healthcare.
Okay.
Out from last week.
Okay.
It's quite a read.
All right. Cool. Thank you. Last but not least, well, I don't know if you're the last person I'm talking to today, but you might be. It's getting late. I'm so glad to be back here with you, Mary Gilston. You're like, what did we call ourselves? You're like my soul.
Oh.
Soul energy force.
Absolutely. We're on the same plane.
We're on the same planet. We come from the same planet.
Yes. Compassion. Yes.
Yes, exactly. I knew you from when we were in our singular office, when we were next door, and I would see you around and come and find you. And now we're blessed because we're in the same office, Amsterdam Family Health Center, because you are part of something called collaborative care.
Correct.
So tell me how you're doing, tell me your background, and tell me what collaborative care is for everybody who's listening.
Okay, so my background is I'm a licensed clinical social worker. I have something called an RNUM, which means 6 years of supervised postgraduate work. And so I was actually in private practice for 10 years because I can accept all insurances. So progressively, I've moved forward with my career because my career is not work for me. There was a time in my life when I was depressed and anxious and struggling, and somebody gave me my life back. And I've always believed that this was something that I was going to pay forward for the rest of my life, and it's not work. So I've told people when I meet with somebody and they're struggling, I think of a house on fire and how am I going to get that person out of that house? How are we going to do it together?
Yeah.
So eventually, whatever you want to put your faith in, whether it's your spiritual being or whatever, I was led to St. Mary's Healthcare, and I started out in the clinic 16 years ago. I found out about collaborative care through some actually just talking with people and became very intrigued by it. So collaborative care is bringing behavioral health, which used to be called mental health, bringing that to the primary care office. Why is that? So we have clinics, we have chronically mentally ill people. Some estimate around 30% of the population is chronic, and deservedly so. Thank God we have brought so many services to these folks. They have, for example, housing. Some of folks need 24-hour housing supervision. Some can live independently with visits. So we have all these things in place for the chronically mentally ill, which absolutely needs to happen.
Yes.
But what we've discovered, like myself, is we have some folks who are not chronically mentally ill, but struggle.
Yeah.
Whether it's, anxiety and depression based in a situational thing or traumatic life events. I have some vets here that have different degrees of PTSD, which is considered anxiety. It runs the gamut from very young people to very old people like myself.
You're young at heart.
I'm young at heart.
Yeah.
I hope I stay that way.
Yes.
So coming here to the medical office has just been this wonderful, wonderful experience for me. I'm working with people like Dr. Majid, yourself, and that has been a blessing. We can go to each other's office and say, I'm really concerned, or I'm having a bad day, or I'm having a great day.
Yeah.
We can just care about each other.
Yes.
Another thing that has been brought to mind is being outside of the mental health clinic and over into collaborative care. I see the whole person.
Yes.
In the old days, you would consider treating the chronic mentally ill person with their mental illness, and that's it.
Yes.
Here, we have a situation where I collaborate with the primary cares all the time. We have found some things like dementia that came through a conversation with a primary care who said, let's put in a neurological kind of consult. This has just been wonderful. And I'm very, very blessed because I have been to different doctors' offices in different cities and locations. I found a home here. I am taken aback at the number of people here who care.
Yes.
And because I'm in this profession, our staff will come in and shut the door and say, can I sit for a minute?
Yeah.
And we cry sometimes over a sad situation.
Yeah.
Or sometimes we jump up and down and hug each other because something has gone really well. So I'm very blessed to be here, and I thank my spiritual guide every single day of my life.
It's so great to have you here and to have something like collaborative care. We kind of blame the pandemic, and yes, it did.
Oh, absolutely.
It did worsen the mental health
Absolutely.
problem, maybe 500-fold is I've read somewhere. Prior to the pandemic, though, our mental health was going downhill as a society. We did already have, there has been some studies. Jean Twenge, she's a psychologist in California. I think she's done some studies and some TED Talks on this topic and with the screen time and all these things, which then the pandemic, the screen time went up because it had to. So whatever the reason is, the pandemic has created a worsening in mental health, but it also helped us realize what you said, we have to take care of the whole person, mental health included.
Absolutely.
Which Dr. Hardies actually just said earlier today, that mental affects physical, vice versa.
Absolutely.
So we have to take care of the whole person if we want to care about those people, which we do. And now our community, our St. Mary's community, the patients we see, the families we see, have this amazing resource. But tell me, Mary, is the collaborative care just for this site, just for Amsterdam Family Health Center then?
Okay, so it was kind of looking back on it. So mental health services were becoming less and less offered. There were places that were shutting down, people deinstitutionalized, hospitals closing. So a whole bunch of stuff was going on. And then the pandemic hit. Mm-hmm. And so somebody that was very meaningful in my life and someone that's very important to me, Dr. Jackie Pasco, and I had conversations about collaborative care. So when this first came to be, now collaborative care is at different places throughout the United States. Again, I just told you, Dr. Majid, that I believe it's 20 to 30 years it's been in California. It's been primary care mental health, or behavioral health, that equation fits the whole person. So you can't have medical over here and behavioral, it's the medical plus individual. When we first started this, the goal was for a person like myself, someone who was qualified to deliver treatment, was going to be in every single St. Mary's primary care office. Mm-hmm. One of the drawbacks has been that we are, across the United States, we are hurting for psychiatrists. Collaborative care individual like myself, a therapist, will meet with a psychiatrist 1 hour a week, review charts. They will, medically and psychologically, they will work with myself, the primary care, and the patient. So we come up with a recommendation to the primary care for psychiatric medications. Right now, we have a shortage of our psychiatrists, as I just said, and pretty much a shortage of people in my profession. So as of right now, our clinic, and I say it's our clinic because it's our family, our work family, is the only one that has this right at this moment. The goal is to have it throughout St. Mary's.
It's a good goal to have.
Yes, it is. And speaking of the pandemic, I think it did, doctors, as you brilliantly put, I think it did shine a very important light on the fact that we are whole people.
Yes.
And that even if we didn't get COVID, we were restricted to our homes. Our children weren't going to school. There was this, I can remember from March to October just working at home and thinking, can this get into my house? What is this thing? So that started to say, okay, let's look at the whole person. And that opened that door too. So this is all a wonderful experience. And I'm very proud and pleased to be in this clinic because it is so representative of what St. Mary's Care can be.
Yes, the mission.
The mission.
Now, so anybody that's a patient in our office can get into collaborative care?
Absolutely. Absolutely.
Well, any age group. I think I start about 11 or 12.
Correct.
Yeah.
So anybody this is the way the collaborative care is structured. So listen, I would take anybody that needed care.
Yeah.
Our policy for collaborative care is that you need to be a patient here. Now, that's the good reason. Mm-hmm. So that, for example, I have seen and am seeing some of your folks, younger people. So the point is to increase communication. So I can go down the hall and say, Dr. Majid, I just met with so-and-so, and the father assaulted him, and, the mother's in my office. We can communicate.
Right then and there.
Right. Yeah. Or I can come down and, as we have in the past, said to you, Doctor, I'm really concerned about, I just saw your patient, 11-year-old so-and-so. I'm really concerned about her level of anxiety, her level of... So it's in-house, and it's a way of just continued communication. Or, doctor, we just started so-and-so on this medication. You can't believe how good she's doing today. I'd like you to see her.
So, yes, we have wonderful news. We help people together.
Absolutely.
And it's such a breath of fresh air in this world. It's like the worst part of having mental health issues is being lost. So
alone, yeah.
So we have that here at our office. So it's something reassuring to our families. Like, this is something that you can rely on us for, too. We can help the whole person. We think of it sometimes, and sometimes the families can approach us for this type of care. How do we get involved with this? How do we get the mental health help that we need? Because waiting outside somewhere might take a really long time. But
a really long time.
Yeah.
And how terrible for primary cares in the past. They would have people come in and not feel well or whatever, but then say, I'm very, very depressed.
Yeah.
And, your only choice was to make a referral to the clinic and hope they got there and all of that. Yeah. And I want to take this opportunity to thank you from the bottom of my heart, as I do the providers here, but I want to take this time to thank you so much for everything you've shown me and everything I've learned from you and for your compassion and care.
Oh,
You've
and
just touched my heart, and I'm very grateful for you.
No, I'm gonna cry. The feeling is definitely mutual. We have a lot of love here.
Yes.
And you're just, words can't express. I mean, you're just a gem here. And a lot of the patients and families feel the same way. So.
Well, I feel like we couldn't do it without each other, and that's what's important.
We all, it's full. It comes full circle. And,
absolutely.
And part of that circle is the community and the patients and families.
Absolutely,
so,
absolutely.
Well,
thank you so
Mary.
much.
Thank you.